Thank you, Ross. You're a great inspiration. Congratulations on the Principals Award. But what he talked about is a great transition, because now we're going to start our healthcare session. Georgia is facing probably one of the most controversial issues that we have faced, and we're not the only state involved in this. It's Medicaid expansion. This is something that about 25 other states have refused to expand Medicaid. But we do have uninsured. We have about 500,000 people that are living below the poverty line. These are able-bodied adults, typically don't have children, but they don't have enough money to afford health insurance in many cases, and they're not included in the Obamacare subsidies on the exchanges. Now, these people do get sick. They typically go to the emergency room. They cannot pay for their entire bills. And so guess what happens? Who pays for it? We all do. We pay for it through state, local, federal taxes and cost shifting. It's about $2,000, $2,500 a person. And these people are waiting until they're very sick. They're going to a very expensive setting of the emergency room. So we're presented with this either-or proposition. Either we expand Medicaid, which we can talk about is not the best kind of coverage and has lots of problems, or we can do nothing. And as Ross said, doing nothing is not a good idea either. I'm going to challenge us today to think about how can we do it better. Why do we want to take a program that has a lot of problems and expand it? Why can't we look at innovation and better ideas, better ways of doing something, so we can truly give access to the working poor to health care, save money over the long run, and solve one of the most important issues. Health care costs are going to bankrupt our country at the family level, the state and the local level, and at the federal level. We have got to figure out a solution to this. Again, this conference is not about complaining and saying no. This is about presenting a positive solution. Conservatives need to be able to say, this is what we believe in, this is how we're going to solve those problems.